Let's bring in Dr. Daniel Bober, who joins the conversation right now. Dr. Bober, thank you for coming on. Last hour, we went through every little detail of this case and, you know, all the legalities and guilty or not guilty. And one of our guests actually did bring it up. It said, this is an issue, not only in this city, but around the country. What are we doing for people who have mental illness? So the background on this guy, Jordan Neely, his mother was murdered, they say, by his stepfather in '07. He developed severe depression, as it's been reported, PTSD, autism, schizophrenia. He was actually on some sort of a list, a top 50 list of homeless people most urgently needing help. That was the background. Again, nothing to do with whether or not, you know, Daniel Penny's guilty or not guilty. But from your perspective, and you watch this case from the outside, what is your take on it?
It's a very tragic case. Jordan Neely did not need to die that day, and his death is emblematic of a system that has failed its most vulnerable citizens. Our correctional facilities have become the de facto mental health asylums of this country. We don't have enough psych beds. We don't have enough psychiatric providers. The system is broken, and it failed Jordan Neely that day.
You know, I was thinking of that other case here in New York where the man, he had just gotten out of jail recently, and he stabbed three people to death. This was recently. Ramon Rivera, 51 years old, homeless man suffering from schizophrenia, indicted on 3 counts of first-degree murder after that. He had been on supervised release in a program with check-ins and therapy. There he is. So another example, right? You say the system has failed. What needs to change? What can change?
It should be noted that the people who are mentally ill are much more likely to be the victims of violence and not the perpetrators. There are certain types of mental illness that do make people at greater risk to commit violent acts, but more often than not, they are the victims themselves. We need ways to long-term institutionalize certain people who are a threat of violence to the community. We need bed space. We need providers who can prescribe medication. We need community resources to make sure that after they leave the hospital, that they have adequate follow-up and that the most at risk are followed outside the inpatient setting.
You know, just maybe this is a micro issue, but it is New York. We're talking about New York. There was a new bill introduced to would expand the pool of mental health professionals, called the HELP Act, who can perform clinical evaluations to determine when a person who has some sort of a mental health issue needs to your point, be hospitalized involuntarily, right? There's some of the bullets behind it. I know this is controversial, I believe, in the mental health, you know, professional community. Some people said this is not a good idea. Is it? I mean, what do you think of something like this?
We need more boots on the ground, for sure. It's always a balance between individual civil liberties and public safety, but we have to have some mechanism in place to protect the public and also to protect the people who are mentally ill. And I understand, I've worked both in New York at Bellevue Hospital, and I also work here in Florida. Certain states are more deferential to the doctor and more of a consumer or societal protection model. And certain states are more like trying to protect the individual with mental illness, like New York, which tends to really focus on letting people out of the hospital, not in a way that's necessarily early, for example, but they really are looking out for their rights to make sure that the system is not abused. And I think it's always a delicate balance to find the midpoint where we're protecting society, but we're also protecting individual rights.
No, understood. I mean, a complicated issue, but simple in some ways, but complicated in the fact that that line of what it is, you don't want to involuntarily put someone in some sort of an institution if they shouldn't be, but at the same time, if they should be, well, then, you know, it's better for them and for everybody else. Thank you, Doctor, for coming on and talking us through this. And as you say, these people are more likely to be victims than they are perpetrators of crimes. But thanks so much for watching. Just go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.